So one of the things that prescribers are often very, very cautious of whenever prescribing stimulant medication for an individual with ADHD is to also assess for whether or not that individual also has intense anxiety, like generalized anxiety disorder or panic disorder. And the reason for that is because stimulant medications can often exacerbate anxiety symptoms. That's why caffeine is usually bad for anxiety. But then you have a person with ADHD, where stimulant medication actually brings them down a little bit, helps the norepinephrine to support the dopamine delivery systems in the brain. So what do you do? What do you do? Well, unfortunately, there's a lot of trial and error in this because there is no surefire magic button or test or blood test or saliva test or anything to determine whether or not somebody that gets put on stimulant medication is actually going to have a positive response to anxiety symptoms or a negative response to anxiety symptoms. And when I'm working with people with ADHD, oftentimes I'll look at like, okay, are the anxiety symptoms brought on by anxiety or are they brought on by executive dysfunction? Because there is a slight little bit of nuance difference, and it takes a lot of questioning, it takes a lot of interviewing, it takes a lot of exploration, because sometimes people are anxious because they're anxious. They're anxious because they're perseverators. They're anxious because they worry a lot. They're anxious because in their brain, somewhere in their life, and maybe multiple places in their life, in fact, often multiple places in their life, they've been taught that the world is an unsafe place and a dangerous place and a scary place. And this is not even like direct sometimes. Sometimes it's just like secondary, like perhaps you had a parent that was very anxious and you said, oh, well, they're anxious, I should be anxious too because my archetype says scary world, so I also should think scary world. But then we have the kind of like subtle anxiety that comes with ADHD, which is the fear of forgetting things, the fear of making sure that you're doing everything right, the fear that you're not screwing up everything, and knowing that you're going to forget stuff and knowing that you're going to get distracted, that produces its own flavor of anxiety. So sometimes when we get on a stimulant medication like Adderall, one thing that I hear from my clients is, yeah, I got on the Adderall, my anxiety went away. I said, no, you got on the Adderall and your executive function improved, which meant that your obsessive worry about everything reduced because it wasn't necessarily just anxiety. It wasn't anxiety purely. It was worry and concern and understanding that your own function is a little bit different than other people's, except not fully consciously grasping that, but more of a subtle subconscious grasping that. So when the anxiety calms, it feels like my anxiety disorder has gone away versus my executive function is drastically improved. I'm able to remember things, so I'm not experiencing as much stress, which means I'm not experiencing as much overwhelm, which means I'm not experiencing meltdowns, which means I'm not like constantly depleting myself, which means what I experienced as anxiety is greatly reduced. So that's kind of an interesting take, and it's not for everybody, but it does happen for many people. And in case you're wondering if it happened to you, that could be what's going on there. Now it's something you know, and knowing stuff is cool, and so are you.